Jamaica and the wider Caribbean continue to face significant public health challenges from viral infectious diseases, particularly those that are mosquito borne, including dengue, chikungunya, and Zika. These arboviruses pose seasonal threats, often leading to outbreaks that strain healthcare systems. In addition, emerging global viruses heighten the region's vulnerability due to high travel and trade volumes. Strengthened surveillance, public education, mosquito control efforts, and regional collaboration are critical to managing current threats and preparing for future viral outbreaks. For a discussion on the state of viral infectious diseases in Jamaica and the Caribbean and information about an upcoming Global Infectious Diseases Conference, I'm joined by Dean of the USF College of Public Health, Professor Sten Vermund, and Professor of Parasite Epidemiology and Director of the MONA Office for Research and Innovation, John Lindo. Good morning, professors.
Morning, sir.
Good morning. Thanks for having us.
You're welcome. Professor Sten, let me start with you. What would you identify as the most pressing viral infectious diseases at play in Jamaica and the Caribbean?
Thank you for that question. We have many challenges in viral diseases, as everyone on the radio broadcast knows. Some of them are very well known to us, like the sexually transmitted viruses, HIV, human papillomavirus, herpes simplex virus. Some of them are vaccine preventable diseases, the most famous of which and the most dangerous of which perhaps is measles. Also, we have polio, many others. But the three that I think we'll be focusing on in the Global Virus Network regional meeting that Professor Lindo and his colleagues at UE Mona campus are sponsoring on May 1st and 2nd are dengue, chikungunya, and oropouche. So dengue, I think, is the most familiar to your audience. We can talk about that in a moment. Chikungunya, named after a Tanzanian outbreak, and oropouche, named after a river in Trinidad. These are emerging viral diseases that we're worried are going to become more and more frequent if we do not get a handle on Aedes mosquito control.
Yeah, and from there, I can ask Professor Linda this, because we have been dealing with these issues in this part of the world for quite some time now, and you'd feel that competencies would have been developed as skills are honed. So how has the region's response to dengue and chikungunya, just to take two, how have those evolved over the past, say, 10 to 15 years, Professor Lindo?
Thank you very much. I think one thing is that we have put more science into control of vectors. For example, there is a group at the university that is dedicated to identifying new vectors, looking at how competent they are at transmitting. And also, we have been considering new techniques for control of viruses. One of them, among the several that we have considered, is the release of sterile male mosquitoes. This is something that is going on at the Ministry of Health here in Jamaica in conjunction with the International Atomic Energy Agency, where they are sterilizing males, releasing them to the wild, and then when they mate with the wild females, they do not produce new progeny. So there are several new scientific approaches, and we are trying to integrate those more and more into our mosquito control programs that go beyond fogging. One of the things with fogging, which we see, and it is very obvious to us, it gets the adult mosquitoes not so effective at getting the larvae that will be, and eggs which will be lying dormant in water. Mm-hmm. So this traditional message of, keeping your stored water free from mosquitoes by keeping it covered and so on, looking for breeding sites, all those remain bread and butter approaches, but we're overlaying those with new scientific approaches.
Yeah, and so, Professor Vermond, what role would you say climate change plays or has to play in the spread of mosquito-borne diseases in this part of the world, the Caribbean?
warmer and you get more evaporation and more vapor in the air, mosquitoes are very, very happy creatures. They can live longer in those conditions than when it's cooler or drier. So there is little doubt among medical entomologists, the people who are the experts at mosquito and insect-borne diseases, that we'll have an expansion of the range so that parts, for example, the Gulf Coast of the United States are going to be at much higher risk than they have been in the past. And endemic areas, such as the islands of the Caribbean, are going to experience perhaps even more intense risk with happier, more vigorous mosquito populations that live longer and longer and have increased numbers of breeding sites.
Yeah.
But I will say that I believe that Jamaica has considerable expertise in mosquito control. I was very impressed when Karen Webster Kerr and Peter Figueroa and their colleagues tackled the malaria emergence in the early part of the century, when you had Haitian migrants escaping terrible conditions in their country, coming to Jamaica and being received warmly. But it was reintroduced into Jamaica after more than 30 years, malaria-free. And you systematically squashed that malaria outbreak and were able to remove that threat from your country. So I'm hoping that kind of talent and skill set can be applied for dengue, chikungunya, and otopouche prevention.
Yeah. And so, Professor Lindo, this upcoming Global Virus Network Symposium, what more do you think the public should know at this time about this event?
Well, first thing, it's a gathering of global experts in virology. The Global Virus Network is a very unique organization in that it is, not tied to the governments, and it brings expertise from all over the world in many, many different disciplines, in epidemiology, control, in vaccine development, in understanding just how humans react to the viruses in terms of our immune responses and so on. So this is a really big deal for us here at the University of the West Indies, and also for the world. I don't know if Sten wants to say something in particular about Arboviruses, which is something that the Jamaican people should be aware of, and which we're going to spend some focus on. So I don't know if you maybe see.
Yes, Professor Vermont, is there anything for you to add on the Arboviruses virus?
Arboviruses has been emerging in South America, Brazil, Panama, and elsewhere. It's a serious risk, I think, for the Caribbean, because all of the same conditions that help it thrive in Brazil, Colombia, Panama exist in the Caribbean. So it's just a matter of travelers coming, perhaps incubating the virus, perhaps they haven't gotten sick yet, and the mosquitoes bite them and transmit it locally. So there is a concern. It's got similar symptoms to dengue and to chikungunya, with very high fevers and severe muscle and joint pains. It's a nasty virus. It can kill under certain circumstances. So we would like to keep it out of the country and keep its risk to a bare minimum. And in controlling dengue and chikungunya, the Aedes aegypti and Aedes albopictus mosquitoes that breed in small containers peri-domestically around the house and around the neighborhood. So trash collection is important. People emptying standing water in their neighborhoods and in their homes, cleaning out the eaves to make sure that it doesn't collect standing water. All of that is amenable to community mobilization and neighborhood participation.
Hear you on that. Gentlemen, that's all the time I have, unfortunately. This 2025 Global Virus Network GVN Symposium. Professor Lindo, where can people find more information?
just go to GVN, go GVN.org online, and you'll get some information there on everything from registration to what's on the conference.
Hear you on that. Dean of the USF College of Public Health, Professor Sten Vermont, thank you very much. And Professor of Parasite Epidemiology and Director of the Mona Office for Research and Innovation, John Linder. Thank you this morning, gentlemen.
Thank you, sir.
Our pleasure.